So welcome everyone to today's panel discussion, Thriving on Campus, Enhancing Mental Health and Access to Resources for College Students. I'm your host, Ed Gaussen, President and co-founder of Mantra Health. Before we dive into our discussion, here are just a few housekeeping notes for today. We anticipate the discussion to last around 35 to 40 minutes, followed by 15 minutes of Q&A. Please use the chat function for any general comments, but yeah, if you have questions during the webinar, be sure to drop them in the Q&A section as you're doing it now. It's great, so we can address just all of it at the end. If you need to step away, don't worry. We'll send a recording to all attendees afterwards. And then finally, at the end of the session, a brief survey will pop up. So we'd love your feedback on the session and any topics you'd like us to cover in the future. If you want someone from Mantra or Single Stop to reach out with more information, that'll be the place to do it as well. So let's start with some introductions on who we are. I'm Ed Gaussen. I founded Mantra close to 6 years ago now, after living through the challenges of seeing a sibling dropping out of college because of their mental health. I'll speak to our scale, impact, and services later on in the conversation, but in terms of what I do, I'm proud to be a leader of an organization of over 150 collaborators now that has been at the forefront of innovation to break down barriers for thousands of students across the nation to access mental health. And I'm lucky to spend a lot of time actually working hand in hand with leaders across campuses nationwide to solve this problem. So very excited for this discussion, and now I'll pass the mic over to Tim.
Thanks, Ed, and thank you all for attending today. It's my pleasure to be here. My name is Tim Lytle. I'm the Director of Business Development and Partnerships at Single Stop. I want to first start by saying that if you're here, it's clear you care about your students and their well-being, and you should be commended for that. Especially, I know students are heading back to many of your campuses, so it's a hectic time. So really thank you for attending today. My goals for this session today and my part of it, I want to introduce you all to Single Stop and provide you a brief understanding of what it is we do and our technology. I'd like to show you how we help your students and in turn help the persistence and graduation rates at your school. And then I want to help you understand how easy it is to potentially get started, no matter how new or mature the basic needs or student service programs are at your school. And lastly, I want to thank Mantra for including us. And I'm really pleased to be here with Janet, who you all will very clearly see has done amazing work at Miami Dade. And it's people like Janet and yourselves that are a huge factor in our ability to increase impact. With that, I'll hand it over to Janet.
Hi, good afternoon, everyone. Thank you very much for being here with us this afternoon. I'm excited to be a part of this conversation. Again, my name is Janet Mapp. I'm the director of Single Stop at Miami Dade College. And my experience is basically I've been here for almost 70 years, overseeing the program at Miami Dade College, over 20 years of experience in non-for-profit. This is a great opportunity. This is an amazing experience for me in education and non-for-profit all at the same time. And I've learned so much since I've been here, and connecting with our students on a daily basis. I feel like I live in my purpose every day, and working with the two organizations that are here today makes it all worthwhile, because we are making an impact in the students' lives that we serve every day. So thank you for being here with us. I'm excited to share.
Thank you, Janet and Tim. All right, so I will move us along, and starting with today, we're coming together as a group that sits on quite a few insights at the intersections of mental health and basic needs. And we wanted to start by setting the stage with some data on and zooming in on a population that is particularly relevant in that regard, which are first-generation students. So these students often face, unique challenges, as we all know, that can significantly impact their academic success and overall well-being. And they're enrolled at all types of colleges across our nation. 1/3 of all college students in the US are first generation, and these students are actually disproportionately affected by issues such as mental health struggles and financial stress. At Miami-Dade, those numbers are actually higher. Close to 60% of students are first generation, and almost 70% are low income. We'll explore these challenges in detail and discuss why comprehensive support systems like those provided by Single Stop and Mental Health are essential for their success. Luckily, we're not the first ones to shed light on this issue, and the scale has been well documented. So this is one of my favorite, or actually least favorite, graphs to depict the challenge we are facing, depending on how you look at it. But in the top two sets, you can see the prevalence of mental health challenges experienced by continuing generation students in blue, and that of their first generation counterparts in red, both indicating that first generation students are experiencing higher levels of depression and anxiety. The really interesting part, actually shown at the bottom, you see that first generation students are 10% less likely to seek out mental health services. So with that reveals sort of a critical gap in the support these students actually need, and begs the question around the importance of accessible and targeted mental health services that are actually uniquely positioned to support this population. So why are these students not necessarily seeking out care? Despite the urgent need for support, many first-gen students encounter substantial barriers. There's actually a few studies conducted around this, but one of them here is coming from Healthy Minds data. It's a survey that revealed a few issues, and I sort of chose the top 4 on the screen around why first-gen students decide not to seek out care for mental health challenges. Financial constraints is unsurprisingly at the top of the list, and it also happens to be the reason in the survey with the highest discrepancy in comparison with their continuing generation peers. But given the existence of free mental health counseling across campuses nationwide, and when looking at the 4th reason being uncertainty about where to seek help, which was actually #1 in a lot of different surveys published in the last few years, it does beg the question, are these students aware of the services available to them on campus? And also, how accessible and targeted are they for populations who may have never sought out care in the past? #3 is also interesting in that regard. When students self-report, I prefer to deal with issues on my own, it's hard not to think about stigma being an unspoken reason here when reading between the lines. It may suggest the importance of how to think about health promotion and relevant public health interventions that will improve care-seeking behaviors for this population. So now that we've talked a little about these barriers, let's transition over to some data around basic needs to think about this a bit more broadly. Over to you, Janet.
Thank you. All right. So basically, what does basic needs look like for us, right? And so basic needs is the lack of access to basic needs and how it negatively impacts students, the well-being of our students, and we want to make sure that we improve the retention rates of our students. I'm going to click onto my database. Hold on a second. I'll be discussing the critical role that meet and basic needs play in enhancing the academic journey and overall well-being of college students by focusing on essential support such as food, housing, mental health resources. We'll explore how these foundational elements directly impact students' retention and completion rates. Ensuring that students have access to these resources is not just about helping them survive, but enabling them to strive academically and professionally. The Hope Center #Real survey. In 2015 to 2021, the Hope Center administered the Real College Survey, the nation's largest, most well-established assessment of students' basic needs. More than 500 colleges and universities participated, and over 500 100,000 students completed the real survey, real college survey. In January of 2023, the Hope Center filed the Student Basic Needs Survey to raise awareness about the types of prevalence and student basic needs on college campuses and provide actionable data that their partners can use to advocate for students and improve services. The survey builds upon its predecessor and the hashtag Real College Survey, which was expanded its content.
Janet,
What
we
are
may.
some,
Oh, sorry. Go ahead, Janet.
I'm sorry, what are some of those findings? The data from the OPE Center reveals that some sobering statistics about the challenges our students face. Over 51% of college students are experiencing food insecurity, which means they don't always have access to sufficient and safe, nutritious food. Furthermore, 45% are dealing with housing insecurity, which includes unstable, unsafe, unaffordable living conditions, and 9% are either homeless or at risk of becoming homeless. In terms of utilization of support and barriers to that utilization, 19% of students who experience basic needs insecurity use emergency aid. Among those who applied for emergency aid, including CARES Act grant, 64% indicated that their experiences was stressful, and 42% of students experiencing basic needs insecurity receive some form of public assistance, and 26% receive help in obtaining SNAP benefits, which is basically food stamps. In 2020, Miami-Dade College was invited to participate in the study. MDC was the third largest college participating in the survey and had the most respondents, 11,501, among all participating institutions. At Miami-Dade College, the challenges are particularly severe. Our data shows that 62% of students have faced at least one form of basic needs insecurity, with 40% increase in food insecurity in the last 30 days. 53% facing housing insecurity in the previous year, and 11% experiencing homelessness. These challenges have significant mental health implications, with 31% of students exhibiting moderate anxiety and 30% showing moderate depression. These statistics underscore the urgent care for targeted interventions to support our students in both their academic pursuits and overall well-being. One way we tackle these insecurities is by partnering with organizations like Mantra Health and Single Stop. We are in a unique position at Miami-Dade College where our students' basic needs and mental health needs are being supported by two technologies that actually integrate together to give our students the chance to even better outcomes. I'm going to pass the mic over to Tim and Ed to talk more about Mantra Health and Single Stop.
Thank you so much, Janet, and really eye-opening data. So switching gears a little bit to Mantra and who we are, our mission is really to provide, comprehensive and equitable mental health support, really tailored to the unique needs of college students. We partnered with institutions at this point across the nation, and what we try to do is really ensure that students have access to the support they need to thrive. And throughout the years, we've worked really hard towards that mission, and we've been able to build a model based on a few pillars of success, which I think for one include quality. We actually own and operate our own provider group to provide clinical care to students on top of the other service lines that exist. And we've put a particular focus around diversity and making sure that the providers that we hire are culturally competent, which I think in the topic of the discussion today is really important. Second pillar that comes to mind here is really collaboration. We've kind of built our systems flexibly to be able to contextualize the experience of our program to the campuses that we work with. and really try to be, a partner that is here to enhance what, existing counseling centers, health promotion teams, health centers do on campus, and ensure that, what we do is not actually duplicative and is really something that, comes in to reach more students, especially those that may not necessarily show up, on campus. And then lastly, Mantra is a company that has put a lot of efforts into its technology and being innovative. As you can see on the screen, that's been recognized through the certifications that we've received and the awards. But we also partner with a lot of innovative companies, such as EAB, some of the schools on the webinar today may be an EAB Starfish or Navigate school. We've actually announced this partnership in January, but Mantra is EAB's strategic mental health and wellness partner, which means that we've built multiple ways to connect our product into their Navigate solution, whether it's the student-facing app or the staff-facing product. And we try to bring mental health interventions earlier into the experience of students. So happy to share more there later on. Just a few data points on the schools that we work with. So as you saw in the previous slide, around 127 campuses now have access to Mantra Health, with almost 1 million students' lives enrolled on those campuses. We work with a lot of students that ultimately are either low income or first generation students across some of the institutions that you see on the right hand side of this screen. One of the most recent partnerships that we're most proud about is with the Minnesota State University system, but Penn State was actually one of the first institutions to sign on with Mantra, and Miami Dade College is also, of course, with the president of Janet today, one of our most, proudest partnerships that we have here at the company. I think this quote on the left-hand side really resonates well with our philosophy. What we're able to do a lot of the time is look at institutions that can be very complex, that have, multiple campuses, and really distill it down to a program that really tries to integrate with what's really being done, and implement in a way that really feels seamless. So happy to dig into this later on as well. And this is kind of our care model. We've brought together some great minds, both on the clinical and digital product side. And we've been sort of able to translate years of experience and evidence on the most successful models to support students on campus, and really turn it into a unified experience that allows students to access service lines across the main categories of a public health framework, which are promotion, prevention, and intervention. Whether it's by allowing students to complete, some micro lessons with our self-care model, or speak to a mental health specialist on demand at any time, or by receiving, ongoing care with a therapist, we've really provided a model that's comprehensive, while having a flexible system to be able to work with you on what the specific needs are for your campus. So while it works better holistically than just the sum of its parts, we can really fine tune a program that works with sort of the existing services that you have on the ground. So with that said, we can go into the Q&A if there's more questions, but I'll pass it over to Tim to talk about single stop.
Wonderful. Thanks, Ed. Appreciate it. So just a brief background on single stop, and really our aim here is to help connect students to life-changing benefits and resources so that they persist and eventually graduate. That is it in a nutshell. It's really worth pointing out how we started, which was with little to no technology. Essentially, we sent an individual to an office on campus. They put up a sign that says single stop, and then they started saying, who needs help? That starting point really means that we understand what it means to be on the ground, providing direct services to students. And we've taken that knowledge to produce our technology platform to best serve our clients, the schools, and those people that they serve, which is students. We can go to the next slide, Ed. So firstly, why do we exist? Why did we choose to do that? This number is from the White House last year. It's an estimate that 140 billion in federal public benefits went unclaimed. And many of, and that's just federal. So not to mention the state benefits. So this number is likely much bigger. Many of these state, federal, and even local benefits in existence today, we know are truly life-changing, especially for a student who may be juggling work, raising children, caring for their parents, along with trying to complete or start their education. We also know, as was stated earlier in a couple ways, that navigating benefits and resources can be complex, can be intimidating, can be time-consuming. I think one of the biggest points is students don't even know where to start. And how could you? You don't know what you don't know in this situation. Additionally, oftentimes, when you're navigating public benefits, government agencies aren't usually the best at, putting their arm around you saying, come on in, this is going to be easy, right? And so you often need to provide your social security number right away, your birthday, your address, several statuses, immigration status, et cetera. And many times what can be the most painful is you don't find out that you've qualified or how much you qualify for until you're through the lengthy process of applying. And heaven forbid you make a mistake, you spend all this time and then they say you don't actually qualify when you really should. Now, besides benefits, there are also many valuable resources locally, we know. But how does a student search for them? How does a student trust that the organization across town is still open and still providing the help that they say they provide online? So with that said, in comes single stop. We can go to the next slide. We simplify benefit and resource navigation by providing a simple starting point for a student. And we do this very simply through our benefit screener and resource map. Students will typically start with a 10-minute screener. So that's all we're asking for, 10 minutes of their time. This will screen them for between 20 and 25 benefits, depending on which state they're in. And then we tell them down to the exact dollar amount what they qualify for and how much they can expect to receive should they apply. We also provide detailed guides that really help take the mystery out of navigating the specific government agency and what to expect during the application process. Next, we allow a student to simply enter their zip code and access categorized and fully vetted local resources in every zip code in the United States. We ensure accurate hours, focus areas, and location details. And then we provide you, the college, the school, the university, with an easy way to keep track of the benefits students qualify for and are receiving, the help that you're providing, and then the ability to track any referrals to local organizations. We also allow for the administration or the qualification of any emergency funds or any student or campus-based benefits. We also allow you to share the incredible impact you're having with your administration, the public, and even prospective students. So imagine just for a second, if you will, a student who is struggling with food insecurity, healthcare, housing, other issues, mental health. After a 10-minute screener, they learn they qualify for Medicaid. They get money, they're going to get money each month and SNAP benefits to buy groceries, benefits for their child, and their elderly parents who live with them. Perhaps they're then connected to a local organization who help them find a new place to live and help them get a job. And because they indicated that they were struggling with mental health, they were connected to Mantra Health and all the wonderful resources they provide. What this means is that student who is potentially preparing to take some time off from school ends up persisting, or the student who is going to drop out altogether finishes and obtains their degree. Simply put, this is really the reason we're all here. So, a question may arise how you get started with something like this. You are going to see and have already seen, I think, the gold standard of a single stop rollout and a single stop rollout in conjunction with Mantra Health, right? The work that Janet and MDC have been doing for years really is impressive. But I want to ensure everyone here that providing impact and incredible value for your students can be done quickly and easily with really a minimal time investment. Whether you're a basic needs department that is fully staffed and built out like MDC, or you're here because you're just starting, or you're somewhere in between, we'd love to be a part of simplifying and accelerating the work you already do. I'll end with this. Part of what makes this panel and webinar so great, as Ed already mentioned, is sort of the willingness and flexibility of the partners involved. MDC had needs, and Single Stop and Mantra Health didn't hesitate to work together to make it a reality. So really appreciate my being allowed to be here, and appreciate my time. And with that, I'll pass it back to Ed. Thanks.
Thank you, Tim. Really well said. And actually, I think we wanted to make sure we had a slide in the presentation today to really talk about how we can collaborate together on a campus that has both Single Stop and Mantra Health. So let's put ourselves in the shoes of a Miami Dade College student for a second. Some student who may be experiencing stress or uncertainty, and is looking for help. And as we've talked about, the stressors can look very similar, whether it is due to some basic needs issues, or if it truly is something that requires mental health support right out of the gate. For that reason, we didn't want to create a barrier to accessing mental health services, but we also know that being able to understand the bigger story behind it is very important. So students can either fill out the Single Stop screener on Miami Dade's website. It's available there and very easy for students to access. As Tim said, it takes only 10 minutes, and walk into an appointment directly on campus with one of Janet's team members, and they're actually called Single Stop coordinators to make it even easier for students to understand on campus. At which point the coordinator and the student we'll talk about what are their needs, and being able to support them from there. Students can also sign up directly to Mantra's Care Hub. This is really the front door that we've built for students to be able to access mental health services, and depending on what's offered, have the ability to navigate directly to the array of mental health and wellness services that's offered by Mantra. On this screen, we put as an example a therapist or a coach. Now, there's multiple ways in which Mantra and Single Stop actually collaborate from there. So on the Mantra side, what we do is two main things. One is, students can actually access the broader basic needs support through referral to Single Stop. This can come from one of our care navigators, or from one of our providers that actually has access to Single Stop on campus. But we'll let the student know that this is available to them, and that they should be reaching out to the coordinator on the ground to explore the resources, and our providers are aware of that. The second piece is that the screener link is actually accessible on Mantra's Care Hub directly. So even if they sign up directly through Mantra, in other words, it is easily available through Mantra's app to know exactly what access to basic needs resources you have access to by just clicking a link directly sitting there. On the Single Stop side, and with Janet's team on the ground, there's also two ways in which they collaborate to drive students towards Mantra. Number one is that a student who's for Mantra, a student who fills out the digital screener from Single Stop may be recommended to sign up directly, from there, looking at the results of their screener. But we also provide the Single Stop coordinators on the ground with a platform that allows them to schedule therapy intakes directly, with our therapists on campus. So if a Single Stop coordinator identifies that a student is in need of mental health services after taking the screener and after having a conversation, they can go ahead and make a referral, and I'll tee up Janet a little bit to talk about what that looks like later on in the conversation. But with that said, Janet, I will pass it over to you to just talk a little bit about the impact and the outcomes of the partnership here.
Awesome. Thank you very much. So Miami-Dade College and Single Stop partnered. Partnership started in 2010, October 2010. So this year will make 14 years since we've been working together. And in that time, we've served over 73,000 students and their family members, connecting over 114 million benefits and tax refunds and support services. The program has had a significant impact on our community, and that's part of the reason Miami-Dade College is still in partnership with Single Stop USA. When the program started in 2010, the program was a grant funded program. So funding came from Single Stop to implement this program here then. The program then, Miami-Dade College then institutionalized the program after 3 years because they realized what an impact this program had had on the college and the community and the students. And there was an increase in retention rates based on the research that was done within those 3 years. So I'm super excited that it has expanded even more in the last 7 years with Miami-Dade College expanding single stop services to all campuses. So we have 8 campuses in Miami-Dade County and 3 centers. We're on all 8 campuses and support all three centers or outreach centers. Since that time, our impact has been significant with serving, the average income for our students according to the data. All this data comes from students self-reporting into our single stop technology that was mentioned earlier. Students complete a screening, and from that screening, this data is generated. Our average income for our students is $9,447, serving mostly, 58% of female, and 53% have more or one children in their household. The goal of our partnership with Single Stop is connecting students to benefits through a screening technology and a high-touch case management model. Connecting students with multiple benefits and services supports their persistence and increase their chances of completing. Again, just making sure that our students get the necessary basic needs that's going to help them to do well, to progress, to graduate, to make sure that they stay enrolled. And as you could see from this list, it goes on and on. And, in Miami, we also serve students, linking students to, legal services is a big piece of what we do when it comes to students who are migrating from different countries and need help with their residency and, getting their documents. So that's something that has expanded in the last several years, as you could imagine. And here we are, back to mantra.
Thank you so much, Janet. And so talking a little about the impact of mantra at Miami-Dade. Our partnership has been going on for about 4 years. We're going into our 4th academic year now. And this is just some data over the last academic year. As you can see, over 1,000 unique students have received therapy services, close to 7,000 appointments over that time period. A lot of the value that exists here is twofold when it comes to the provision of clinical care. Number one is, of course, the diversity of providers, which allow us to get a really good score on the matching front. I know there were a lot of questions in the chat around, can students sign up directly and choose a provider? And the answer is yes. So that is something that is available. And then the second piece is that appointments are actually really available not only during the day, but during evenings and weekends as well. So more than 1/3 of appointments happen during evenings and weekends. And when we talk about reaching some of these students that may be lacking time, maybe not engaging with some of the abilities on the ground, perhaps they're working a day job. They don't have the time to walk into a counseling center. And so being able to connect in evenings is something that's really, really valuable. The other piece here, just to show some of the exciting outcomes that we've seen, is that 68% of students who started treatment with mantra, with severe depression, actually saw meaningful improvements. So that's something that we're really, really proud of, especially as it comes to these students who could be high risk. I'm mindful of time here, but the other thing that I'll add is that we do also measure our ability to support students, prevent from dropping out and persisting, and that's something that is asked during the course of care with the students that we work with, and 75% of students at Miami-Dade that were actually high risk coming into the experience in terms of self-reported ability to persist, improved on their dropout risk. So that's something that we're really proud of, and our outcomes go beyond just mental health, but also academic success. Janet actually, wanted to leave a bit of space for you to talk a little bit about how you've seen, anecdotes of students walking into, your centers with coordinators and their experience with mantra.
Absolutely. Thank you very much, Ed. Definitely had many of opportunities to serve our students at Miami-Dade College. We have a couple options for our students with getting mental health services. One of the services that we provide is through Mantra Health, but we also have an in-person, on-campus opportunity for students who want to see somebody in person. We have that option available. But with Mantra Health, when a student walks in, I'm able to connect the students right away with someone in person, on Mantra, because our in-person is by appointments only. So having Mantra here to connect to the student right away, it's super important. I could have the student log in as a student at Miami-Dade College, get access to the hub, create a profile, and immediately get connected to a self-help process there that the student can actually do self-guided work on, for example, coping with anxiety or coping with stress. There are actual videos there that students can watch, and it progresses through the entire process. So students can actually get the information right at their fingertips and get connected to also making an appointment with a therapist if they feel that the self-guided work is not for them, right? So we could definitely do that at that point. Once the student walk into our office, we could get them connected to the hub so they could do self-guided work on their own, or they could actually make an appointment. What I love about the Mantra Hub is the opportunity that students get to choose which therapist they want to work with. So the student could actually see a picture of all the therapists that's available, all the times that are available, and have a choice in who they want to share their story with, right? So that provides our students, again, more opportunities to be themselves and to choose who they want, because it gives a clear picture as to what the expertise, if you may, for each therapist as well. So the student maybe want to focus more on LGBTQ issues, for example. They could actually pick a person that's their focus. And so it's been a very pleasant experience, and we've only gotten very good results from our students, or feedback from our students when it comes to using the Mantra Health platform. They love using it, and a lot of it they could log in on their own. They don't need someone to help them to get connected to services, so we give them the freedom to choose. Thank you.
Thank you, Janet. Yeah, really, really appreciate those kind words. And I'm mindful of time. We're at 1:42, and we wanted to leave some time for some questions at the end, but we just have 2 slides left. And Janet, I'll pass it back to you to talk about some of the future facing stuff here.
Absolutely. So at Miami-Dade College, we definitely have a toolkit that of resources that we connect our students with. The first one I'll talk about is we partner with an organization called Educate Tomorrow, and they're a program that works primarily with students who've been impacted by foster care or have been impacted by homelessness. And so we're able to connect those students to get in, for example, a tuition waiver from the Department of Children and Family here, which is tied to our foster care agency, so that students can go to school up to their 28th birthday. When it comes to homelessness waiver, they could get one from a shelter or from the Miami-Dade County Public School here, if they're having any type of housing insecurity. And those waivers also provide opportunities for students to go to school, for free, to waiver. In addition to that, we of course have the mental health counseling that has expanded tremendously over the last several years, with having not only an in-person therapy on campus, but having Mantra Health as an organization that provides that support for our students as well. We work with community partners to do financial coaching for students. We have food pantries on all our campuses. We work very closely with other community organizations, especially around the holidays, Thanksgiving, to deliver meals to students' homes. And of course, our college has what's called student emergency aid, or student emergency funds, that help our students when they run into any type of crisis or situation that's going to prevent them from finishing out the semester successfully. Students can apply for up to $1,000 in the academic year, no more than 500 in each semester. And of course, we have bus passes. This is a big hit for us. We partner with our local Miami-Dade County Transit, and we get monthly bus passes for our students. Still not enough, but our MDC Foundation, or our leadership at the college, has provided support in buying additional bus passes for our students so they can, get to and from school. And then, how we equitable support our students. As we look to the future, Miami-Dade College is deeply committed to strengthen and expanding the support system available to our students. We recognize that meeting basic needs is just the starting point. Moving forward, we are enhancing our efforts in several key areas. We're increasing access to mental health counseling and financial coaching. Our food pantries and emergency funds are being expanded to better serve in need. We're also providing bus passes, technology support, financial incentives to reduce barriers in education. In response to the evolving needs of our students, we've adapted by offering more remote learning resources, expanded our hours, and increasing virtual access. We've also introduced adaptive teaching modalities, expanded the mental health services, and increased food distribution and pantry access. Additionally, peer mentoring and support groups have been ramped up to ensure that students have a network of support throughout their educational journey. Our goal is to create an equitable and supportive environment where every student has the resources they need to thrive academically and personally. These initiatives are not just about providing aid, they're about empowering each of our students in their educational journey. Our goal is to create an equitable and supportive environment where every student has the resources they need to thrive academically and personally. These initiatives are not just about providing aid, they're about empowering students to reach their full potential, no matter what the challenges they face. And that's what Miami-Dade College does as a whole. We make sure that, I like to say that we are always looking what our students need and trying to find a way to provide those support services for our students so they could flourish and do well. And, our ultimate goal is that every student that come into our college graduates. Thank you.
Thank you so much, Janet. All right, I will turn it over to the Q&A section for today. I know we've been talking a lot, and there's also been questions thrown in the chat as we've gone through it. So as you think of questions, what I'll do is start going through the chat and answering some of the stuff that's in there, or kind of reassigning it depending on what the question is.
Yeah, I can take a couple quick ones to just knock them out real quick on our side. So someone asked about FAFSA or other documents required for the single stop screening? Absolutely not. We collect as little information as possible. We're not collecting things like Social Security, full name, address. So they don't need any special documentation, really just a preferred name and their date of birth. No real strong identifiers. And then the other question, I think best equipped for Janet to answer, but they asked, do you have to fill out a single stop screening, or can you just make an appointment? From our side, we don't really have an opinion on that. It's really up to the university or school to determine how that works. So we don't hide anything behind our screener. You can make it available publicly online for students, or you can have them come in to an office first. But I can let Janet address that piece as
So,
well.
yep. So basically, we have a service center, for example, at one of our at our North campus, where students actually physically walk in, and one of the main service that they come in for is filling out their FAFSA application. So on situations like that, when a student is only filling out their FAFSA, and the FAFSA application is so lengthy, we tend to not have the student do the entire screening. They just do an initial sign-in, which is just giving us basic information about themselves so that we know who's in the space with us and who've actually applied for FAFSA. If the student comes back for additional services, for example, they want to get mental health counseling, or they want to use our food pantry or our career closet, or want to apply for student emergency aid, then the student is required or asked to complete our single stop screening at that point. And with when it comes to the mental health, the online hub, students don't necessarily have to fill out the screener. They can actually go in and make an appointment with Mantra Health without filling out the screening, and get services also without the screener.
Yeah. Thanks for answering that question, Janet. And there's a question around, is there a recommended coordinator to student ratio, or does each campus only receive one coordinator typically?
So typically, each campus has one coordinator. We do use a lot of volunteers and student assistants to provide support for our students, especially when it comes to filling out the FAFSA application, or just taking a message or answering the phones for us. Some campuses are busier than others. We have 8 different campuses. We have 3 that are the largest campuses, and those campus we tend to have an AmeriCorps Vista representative helping to get volunteers to help us in our food pantry or our career closet, but doing indirect services for our students. And of course, we use a ton of student assistants to provide support in those service areas.
Love it. Thank you.
Mhm.
All right, so going through the rest of the questions here, is Mantra in person? We are not in person. We are a fully virtual experience for students, but we collaborate very closely with the on-campus staff. Just wanted to make sure that was clear. I think Janet is kind of referring to the fact that both Mantra, but then also in-person therapy is available at Miami Dade. Are there specific types of therapists, providers for particular needs? Yes, there are. We have a very diverse provider group across, all 50 states. Each of our providers, I like to think, are very unique in terms of their clinical specialties, their background, how they identify. About 50% of our providers identify as people of color. But in terms of clinical specialties, that goes beyond depression and anxiety. So happy to get on a call and talk more about our clinical scope and what we handle. And to that end, we do have psychiatry services as well. That's a great question. We are able to do evals and ongoing medication management with both psychiatric nurse practitioners and also psychiatrists. There's another questions around what were the primary concerns of students who did not feel Mantra improved their mental health? Any steps being taken to address those concerns? That's a great question. I think the biggest challenge we get sometimes is around the fit between a student and one of our providers. So this is why we actually allow the ability for students to change providers. There's a whole set of reasons why this could happen. It's not specific to Mantra. quite frankly, it's something that is just a real challenge in the space in general. It's not without saying that we do also encounter challenges with some of our providers sometimes who may not show up in a way that we would have wanted them to. And if that's the case, this is why Mantra actually employs a layer of clinical supervision and clinical managers who are here to review clinical notes, to be able to support cases when they escalate. If a student is in high risk, we have a high risk team within our provider group. And we're really here to, make sure that we provide excellent care at the end of the day, and that students' needs are being met, which is, why we've been able to have such strong satisfaction scores. All right. I think that covers the questions that were outstanding. Were there any other questions as part of the group that were provided? I see another one here that came in directly to me around actually, what is the implementation like for either single stop or mantra? So actually, Tim, do you want to go first on that one?
Sure. Yeah. We have really about a week and a half implementation. Our solution's out of the box, so there's not any heavy tech lifting or anything like that. It is really about strategizing and training on the ground staff, strategizing around how this is to be marketed, and we help with marketing support, ongoing training, and ongoing customer support as well. And then I'll just answer another one. Impact benefit made available per student household. Across the board last year for single stop, it was 17,600 per household made available. We recognize fully that some of that they already have, right? We're not trying to claim that we're responsible for everything, but 17,600 was made available. Many of that, they might have had already, but still very, very strong number there.
Yeah. Those numbers are really impressive and exciting for the students. Congrats on this impact. Talking a little bit about the implementation process at Mantra, of course, it's a comprehensive program that we can offer. The timeline will depend on the service lines that we decide to move forward with. But typically it can look as short as 2 weeks, and as long as for a single campus, call it 4 weeks really. There's several steps in the process that we typically take to go live with a campus. Typically, there's a kickoff process that happens to align on the program goals, review the onboarding process. We, first and foremost, go through a single sign-on sort of care configuration to be able to make sure that students can access the services directly. But there's also a development of the processes and emergency protocols, for example, that you have on campus that we set up in our systems so that our providers and our care navigation team has access to those. If this is a model where we're going to be providing also campus marketing support in the case of really our comprehensive model with all these service lines in a meaningful way, we're going to do a discovery to find out how you're currently doing health promotion, what are the populations we can target, and ultimately the last thing that we do in implementation is really training relevant campus stakeholders on Mantra's model, how to collaborate, how to use our collaboration portal, which we didn't talk about today, but is really a cornerstone of the success of our program with schools that have a counseling center and health centers on the ground. So just a few details there, but generally speaking, it's pretty smooth sailing, and schools are really happy with our implementation process. I know we are coming up on time. Janet, last question for you. Save best for last. How'd you get campus buy-in for something like Mantra or Single Stop?
Oh, wow. I think it starts at the very top. with our leadership. And at Miami-Dade College, we have definitely great buy-in from the very beginning, I think, with having single stop here and eventually providing having Mantra on board, making sure that our students have everything they need to succeed. When I started here 7 years ago, we only had probably 2 days a week, well, 1 day a week at my campus for mental health counseling. And it just grew because the college realized the need was so great for students at the college. So they've expanded with having, in person, and then eventually, I mean, I couldn't believe it, online during the pandemic. And it has just been an amazing experience for students having the flexibility to be able to get therapy in the evening, at nights, on the weekend. It's just incredible. We had very limited access to care in the past. And so having Mantra here has been a game changer, I think, for our students. We get students always coming in telling us it's been a good experience when they work with Mantra. And, it's been very good for our students. And I'm excited that you're here and you're able to expand your services to create the hub for our students, which is now self-guided and now peer experience for them as well. So it's only been an uphill. It's been getting very good for our students, and they're excited about the changes as well.
Yeah. Well, we love Miami-Dade with all of our hearts at Mantra. And with that said, it's 1:59 here in New York City. Thank you all so much for coming today. Our team will follow up with you all with the recording, with some information around, the presentation today. And I'm available, Tim's available, and Janet, very nicely agreed to sharing your email address as well if you have any questions. So we'll go from there. But thank you for your time, and we'll be in touch.
Thanks, everyone.
Thank you.